So then, Julieanna, the question really is for you. We've had a lot of people over this conference and more to come who have saying lots of brilliant things based on evidence-based research and lots of research they've done. But in your actual day-to-day practice over the last 15 years, of all the people that came to you with high blood sugar, pre-diabetes, diabetes, that you then worked with, how successful were you in getting their blood sugar to a healthy level? And how often did it not work? And what did you do to get their blood sugars under control?
It works. Results are typical. When I was in graduate school and in my internship, I was taught that the role of a healthcare provider is to mitigate the need to increase the dosage of medication or to mitigate the progression of the disease. We were not shown or taught that we could actually get off of medications and reverse these chronic conditions and diagnoses. But alas, for 18 years, I see it every single day. It is absolutely extraordinary, specific to high blood sugar. Well, what's so interesting is when I started 18 years ago, people were coming to me and they wanted to go plant-based. And so when they were plant-based, it was mostly these omnivores coming to me that were eating the standard Western diet. And of course, they got better. They just get better. It just always works. It always works. If it's not, you could still fine tune and still improve. I've never seen someone not improve by changing their diet. Honestly, I never have. I've seen people not improve because they're doing other things. But when you follow this plan, it works. But what's so interesting to me, and I warn whenever I talk to a vegan audience or people that are plant curious, please be careful. In the last decade, there's been a preponderance of new products on the market, and we celebrate it from the ethical side of it. But what I'm seeing every day are vegans, long-term vegans, coming to me with the same health issues as the omnivores do: high blood sugar, high blood pressure, high cholesterol, obesity. And it's because when I look at their food journals, and I've looked at hundreds of thousands of food journals, it's these really highly processed foods. Because just because, a burger and ice cream is vegan doesn't mean it's healthy, and it still has sugar and it still has saturated fat. And so I like to get people onto a whole food plant-based diet, and we definitely see improvements. And I literally don't see it not working. I've never seen it not working with someone that's really doing all of these things.
Can you be more specific? So what is the plan if someone comes to you and saying, my blood sugar is high? Do you limit their fat? Do you limit their sugar? Do you limit their oil? How do you get people to get their blood sugar to a healthy level? What is the specific recommendations?
So again, I can't be specific because everyone's a little bit different, but generally speaking, I will remove the refined foods. I remove all of the refined sugars. I remove the oils. I don't think oils are necessary they're not necessary. And most people are better off without them. So all of my recipes and all of my 9 books are oil-free and refined sugar-free. And then for people that are trying to lose weight, because not all the time, but a lot of times people that have high blood sugar are also overweight or obese. And so losing weight can definitely help with that just by losing weight itself. But also we improve the diet. So we're eating whole foods. We're not doing white bread. We're doing quinoa, we're doing legumes. I have this mnemonic that's in a lot of my books and on my website called the 6 Daily Threes. And it's a way to prioritize foods, because I always say I want you to eat a diet based on vegetables, fruits, whole grains, legumes, mushrooms, nuts, seeds, herbs, and spices in infinite tasty combinations. But how do you make that look into a meal plan? So the 6 Daily Threes are the 6 food groups that have unique nutritional qualities that you can't get elsewhere. And you should prioritize them in your diet so that you're getting everything you need, save for those notable nutrients we talked about before. So the 6 Daily Threes are like the 6 food groups to try to get every single day. Leafy green and cruciferous vegetables, incredible for your arteries and your blood sugar, all of that. The other colored vegetables, fruits, and then legumes, lentils, peas, beans, hummus should be a food group, and soy foods, and 1 to 2 ounces of nuts and seeds. So much evidence, mounting evidence on the cardiometabolic benefits to nuts and seeds, including in attenuating blood sugar and attaining euglycemia. And the 6th group I've added recently is mushrooms, because they have an extraordinary array of very unique these very bioactive compounds that promote health across multiple different mechanisms. So if you try to incorporate all those foods, it's great. And you don't have a lot of wiggle room for all the processed foods. If you're really high blood sugar and you really want to get going, get rid of all that stuff. Go whole tofu, get it off the table. It's not in your diet ever. You're just eating these whole foods. You will see these results very dramatically. So much so that when someone comes to me, which often happens, and they're on a medication for high blood pressure or high blood sugar, since that's what we're kind of focusing on, although it's a one size fits all approach, honestly, I make sure that they warn their physician, because their physicians have not seen the success that they're going to see with this kind of, like, tell your doctor, you are going to be on a very dramatic change in your diet. Please be ready to change the dosing of my medication, because it can quickly get dangerous because your blood sugar drops fast, blood pressure drops fast. I had a student in my recent group. He was on 3 blood pressure medications for his entire adult life. Within the first week, got off of them. I see this every single day. So you have to be really careful when there's a medication involved. But the diet is very generalizable to any of those health conditions, all health conditions, and improving health. If you eat these whole plant foods, you will have improvements in all of the biomarkers and all of your chronic conditions. Things I never thought I would see, reducing acne and chronic pain and inflammation and psoriasis. And it's just extraordinary how powerful this diet is.
So now that I'm turning 60, I can look back when I was 17 years old and people smoked cigarettes, and I said, they're not good for you. They could laugh at me and say, what do you know? And I really didn't. What could I say? No, nothing really bad happened to 17-year-olds. But by the time you're 60, you look back and go, yeah, cigarettes are bad. People have really bad outcomes who smoke a lot of cigarettes. From all your years being around athletes and bodybuilders and nutrition people who eat the keto diet, who eat the paleo diet, what happened over the last 20 years? Because there's still a ton of books and a ton of people promoting keto. So in the short term, it seems like people eat whatever they want and they're okay. But over time, you do start to see results. So what have you seen in comparing the people who eat a whole food plant-based diet versus the people that eat the keto paleo diets, both in the gym and out of the gym? Is there anything that you could point to, or you can't tell because it's just too hard to tell?
I think, if I could just chime in really quickly, I think there's always consequences, Stephen, that sometimes they don't reveal themselves until way later on in life. Like, let's say you smoked when you were 17 for X number of years or whatever. Not saying that you did, but a person did. Maybe that comes back later on. Or a very, very inactive lifestyle with a lot of heavily concentrated calories consumed at a young age, where your metabolism is still great and you're young and you're feeling great. But this adds up over time. We saw this. We've seen this a lot recently. I mean, we have something like a 98% of population eating an omnivorous lifestyle. 73.6% of Americans are overweight, 42.5% are obese. This is not to body shame anyone, but it's to sound the alarm that means there's often something else going on there. And though I don't have clients, one-on-one or anything like that, I have hundreds of thousands of readers. And what I found is that, to quote Jeff Novick, when people are eating crap, calorie-rich and processed foods, crap foods, they tend to start to lean towards some of these problematic areas. And like Julieanna said, and she actually has that data, that pool of evidence, that when you get rid of the crap, you get rid of the calorie-rich and processed foods, you do start to feel better, recover, heal, that kind of thing. I think there's just a lot of dormant stuff going on where people feel fairly invincible, where they can eat whatever they want, live however they want, follow whatever kind of diet is popular or trendy at the time. But I think there's always going to be consequences. And we have lots of studies that show the impact that certain dietary lifestyles and nutritional approaches have on overall mortality rates. And I'm sure, Derek is focusing on a lot of that these days. So that's, in my observation, in nearly 30 years, doing this stuff, and even my own observations for myself, I am feeling my worst, in my worst shape, when I am eating too much crap. And so I think pointing to whole food plant-based is the solution. The question is, are we disciplined enough to do it, and do it on a continual basis, and to find enjoyment from it and make it part of our daily routine, with all the temptation that's around us, with highly concentrated, cheap, marketable food that's on every street corner? That's the question we have to answer for ourselves.
Thank you.
Absolutely. Great answer, Robert. I would say, no, I don't have a ton of side-by-side comparisons. A lot of people are coming to me because they're plant curious or wanting help with a plant-based diet. But I have a number of clients who are not vegan, who are just kind of leaning that way as well. And being in a fitness community, having these friends on Facebook and social media, and just seeing people in the gyms, I would say that in my experience, again, anecdotally, people who focus on carbs as the problem struggle with weight regain more. People, they go on a low carb diet that's very strict. They lose a ton of weight quickly because that happens, especially because of the water weight from loss of glycogen stores. But people don't stay on that diet. There's too many food cravings. It's not as sustainable. And then they regain more. And so I see more yo-yo dieting in that crowd. And then also with people I've known for 10, 15, 20 years who've had that style of dieting when they're trying to watch their weight. I see more of those chronic conditions that are just part of the standard American diet in those populations versus someone who's doing things a more plant focused, tend to have healthy cholesterol, healthy blood pressure, healthy glucose levels. Even if their weight's fluctuating more than they would like, and if they're getting more processed foods than they want, they seem to have better health markers and not that need to go on a lot of prescription medications. Again, it's anecdotal and I don't have a huge pool of evidence there, but that's been my observation.
I have people coming to me that are recovering from that way of eating, and it shows up in their labs. It just shows up in their labs. And they said, I felt horrible. I was miserable. I lost weight and I was doing better because it was better than my standard Western diet because I cut out sugar and whatever. But they come to me in a really not healthy place, and a plant-based diet can definitely help recover from eating that way. Just that onslaught of animal product and oils and stuff like that, and not having fiber and phytonutrients. So there's actually this kind of interesting thing that happens when your microbiome is, because it's constantly shifting. And so if you're eating all animal products and you have a completely different microbiome profile, and then all of a sudden you shift it, it's going to be uncomfortable at first. All of a sudden you're getting some fiber, and all of a sudden you're getting a whole different thing. Everything's kind of shifting around. So my advice is just to be patient and go slowly, and know that you can get back all of your health markers and energy and recover and still keep your healthy weight, however, by eating a whole food plant-based diet.